Hello, my name is Maureen O'Donnell, and I'm going to be doing a presentation on forensic nursing. Forensic nursing is the application of the nursing process to public or legal proceedings. Forensic comes from the Latin forensis, for forum, or relating public debate in a court of law. The forensic nurse applies forensic healthcare and scientific investigation of trauma related to abuse, violence, criminal activity, or accidents. Forensic nursing is a relatively new specialty. It's barely 20 years old, but it does date back to the 18th century when midwives would be called on to testify in matters of virginity, pregnancy, and rape. In recent times, it has emerged from the practice of clinical forensic medicine. The first journal article appeared in 1983, and then in 1991, Virginia Lynch, who was really the pioneer of the modern forensic nursing movement, delivered a proposal for the scientific discipline of forensic nursing. She recognized the importance of emergency department nurses in forensic care. In 1993, University of Texas at Arlington developed the first master's program, and then in 1995, it was officially recognized by the ANA as a nursing practice. The classic roles that you would normally think of in forensic nursing would be like for the rape exam or forensic nurse witness. But I was surprised to learn in my research that it also applies to human trafficking, correctional nursing, disaster and emergency management, and coroners. Primary activities, providing nursing care to clients, injury identification, evaluation, and documentation are critical, as well as collecting and preserving evidence and then giving expert testimony. Education required to be an RN. There are multiple avenues after becoming an RN to becoming a forensic nurse. Certification programs, continuing education courses. There are some schools that offer elective courses in forensic medicine that you can minor or concentrate. And then there are also specialized graduate programs such as evidence collection and forensic law and science. There are several certifications in forensic nursing available: sexual assault nurse examiner for adults and adolescents, and also sexual assault nurse examiner pediatrics. Both require at least 40 hours of classroom education and an additional minimum 40 hours of clinical experience. Advanced forensic nursing certification is more in depth, requires 2 years of nursing experience, graduate degree in nursing, at least 2,000 practice hours in forensic nursing in the past 3 years prior to application, as well as the minimum of 30 hours of continuing education in forensic nursing in the previous 3 years to application. Necessary skills and knowledge. Forensic nurses must be very detail-oriented and systematic in their approach. You must have experience in the emergency department or trauma, knowledge and skills in documentation and interviewing, extensive knowledge of forensic science, and also legal knowledge. Must be familiar with criminal, procedural, constitutional, and forensic law, including culpability, burden of proof, rationale, punishment and justification, also the defense issues of insanity, entrapment, duress, and mitigating circumstances. Forensic nurses collaborate with many disciplines, of course, physicians in the emergency department, lab technicians, law enforcement and first responders, lawyers in the courtroom, judges, social workers, public officials, and others. Education learning strategies, not as big a focus in forensic nursing as it is in some other community nursing roles. But there is the important education in risk assessment when treating a client or a patient. One thing I found interesting in my research is that there is a risk in doing a risk assessment of alienating your client or patient. It's very important to evaluate their strengths as well as their vulnerabilities, so that you don't get them to turn off when you're trying to interview them. And there is a tool called the short-term assessment of risk and treatability, which balances out evaluating strengths and vulnerabilities. Mental health promotion is also very important in all disciplines of forensic nursing and public relations as well. One final thing that was of interest to me in my research is the issue of vicarious trauma, which is a concern with forensic nurses who are exposed to a great deal of trauma and disturbing conditions and events, and can develop changes in their cognition and worldview resulting from an empathetic response and repeated exposure to the narratives of trauma. So forensic nurses have to guard themselves against becoming too emotionally involved or risk suffering from actually a form of PTSD, post-traumatic stress. And there are my references. Thank you.